Our moms usually feels like because the baby is born premature, their body is not going to produce milk, and that is a misconception. But moms that had babies that are born premature will produce milk that is specific for their babies. The mom is not going to produce breast milk right away. The first milk that any mom will produce, either preterm or term, is going to be colostrum. It is a specific milk that has the components that are necessary in those first few days of life, and it's just going to be a few drops that they will obtain every time they pump. And I mentioned pumping is because premature babies are not able to breastfeed. And that is also something that our moms might not be aware, that as early as their baby is, their body's going to produce milk, but the baby's not going to be able to take it directly. We will give it to the baby as an oral care. That means it's going to be introduced on the cheeks inside the mouth. We do know that babies that are receiving mom's own milk will have a better growth. Some of the diagnoses that we have for our premature babies can have long-term consequences, and that includes chronic lung disease, necrotizing enterocolitis, retinopathy of prematurity, and those are just different diagnoses that our premature babies can deal with. We do know that having those babies on breast milk compared to formula will give them the immunological protection to try to reduce the risk of the diagnosis or have it as a lower severity. And we need to understand that when we talk about breast milk, and even from mama's own milk, it is not an all or nothing. That means if the mom is having problems producing enough milk, it is better to produce some than not produce any. And that is where we come into play in helping our moms continue to produce.